Today, I am delighted to be joined by our guest, Lisa Frederickson. Good morning, Lisa.
Good morning, Matt. Great
How are
to
you?
be here. Thank you.
Great to have you here as well. Thank you very much. Now, Lisa is an author, speaker, consultant, and founder of the website breakingthecycles.com with a strong purpose and dedication to provide education, prevention, and intervention services on a range of addiction-related topics. Now, Lisa, you have over 40 years of experience with a phenomenon which I believe that your followers and your readers have come to know you best for, which is the notion of secondhand drinking. Now, could you tell us a little more about how you got into the field and also just touch upon the notion of secondhand drinking?
Sure. Actually, it's been over 16 years. I got into this in 2003 when one of my loved ones entered a residential treatment program for alcoholism. And I was finally faced with the realization that I'd actually been dealing with several loved ones' drinking problems. I started in my journey in 2003 to try to understand then what this whole idea of alcoholism and what it does to the family was all about. And it was quite a journey, as you can imagine, to regain my physical and emotional health and the quality of my life after so many decades of coping with it. But the thing that really, really helped me was research. You see, I'd been writing and speaking in the women's history movement and the civil rights movement. And so I just kind of shifted those efforts into trying to understand this emerging science that was explaining the brain was at the root of all this and how could that be? So I just delved into that, and that's what I've been doing for the last 16 plus years. And then I share this information through books, podcasts, interviews, radio shows, that kind of thing. And it's so important because you see, there's nearly 80 million Americans who are affected by someone's drinking, and then there's millions more worldwide. So we need to try to understand this. And that's how I came with that term secondhand drinking back in 2009, to try to raise awareness that there's an impact of somebody's drinking behaviors on others.
Yeah, certainly in America, and I mean worldwide, as you were saying as well. And what is it particularly about the COVID-19 situation that sort of makes, which causes such an increase in drinking problems and also secondhand drinking?
It's basically the stress, if you will. So COVID-19 stay-at-home orders put everybody in the family together in the house at the same time. And with the added stress of working from home, of fear of the virus spread, lost jobs, children at home trying to do school, dwindling bank accounts, just elevated the stress. And one of the things that soothes stress is drinking, because the way the chemical and the ethyl alcohol chemical in the alcoholic beverages changes, works on the pleasure pathway. So this being stuck at home together really started to bring drinking problems front and center, whether they were there, whether somebody who was in treatment now relapses, whether somebody is starting to escalate their drinking, the secretive behaviors, the lying, the deceit, the escalated tensions of the fear and the frustration and the anger, not only over the drinking, but just everything else. And so it just is bubbled up, and it's a very big problem.
Yeah. Now, of course, we're banking on your expertise to sort of provide suggestions and concrete measures for our viewers. So what are, like, as I said, concrete measures and suggestions you can give our viewers?
Sure. So the first one is not to get stuck on whether it's alcohol abuse or alcoholism or, what to identify it. The idea is, because there's a range of drinking. It's not just alcohol use and alcoholism, there's a range. So my first suggestion is, instead of trying to figure all that out, just ask yourself, do you have a loved one whose behaviors change when they drink? And if their behaviors change, then that's a problem. So then go on to step number 2, which is to try to find out what is considered normal, what is considered a problem, how does somebody develop the problem? Can you change it? Can you go back to drinking? Can you stop? How you treat it, that whole thing. And then the other thing is to find out what to do for the family, that secondhand drinking impact. Because see, secondhand drinking, the impacts are related to toxic stress, which is that hammering on the stress response. So not only is it hammering coping with the loved one's drinking behaviors, but it's also those other issues of COVID-19 that I just described. And that toxic stress is what results in migraines, stomach aches, stomach problems, anxiety, depression, sleep problems, skin problems, heart problems. It's incredible. And so we've been looking typically towards resolving those symptoms and instead really getting at the underlying issue. And with 80 million Americans affected by someone's drinking and hundreds of millions more worldwide, likely it's drinking in the family. So, and then
impressive numbers. I mean, I must say. And now, of course, I like to say, that for whatever question we may have, every single one of us, we're always just a Google search away from finding relevant piece of information. So where do you find this kind of information? Can you inform our viewers on that?
Yes, now where we are in this research, there's so much out there, but again, it's just kind of not mainstream. But the National Institutes of Health, National Institute on Drug Abuse, and National Institute on Alcohol Abuse and Alcoholism, for example, are two tremendous resources on trying to find out about drinking, what they call alcohol use disorders. There's also a huge now body of research around toxic stress, and that can be related to trauma, what happens in the family, that secondhand drinking impact, if you will. But there's something really that consolidates all of that and makes it easy to follow, easy to grasp the drinking problem, and then what you do for that, and then what happens to the family and what you do for that. And it's the 10th anniversary edition of a book I wrote in 08-09, because you see the explosion in research and understanding since then, 08-09, is something like the cell phone, where we had the smartphone in 07, which was a huge advance over that flip phone. But then the smartphone today has everything on it we need to run our lives. And that's what my latest book, it's the 10th anniversary edition, If You Love Me, You'd Stop, which you really need to know when your loved one drinks too much, can provide. And it's available in paperback or Kindle.
Excellent. Well, thank you very much, Lisa, for your expertise and your help today. And I think a further topic of discussion, as you were saying before, one other area which has evolved immensely over the last decade, certainly over 20 years, is the neuroscience. And I believe that latest discoveries there can also help us, provide more information on the potential of the brain, and that it is not a fixed entity, but it is susceptible to change, and thereby also certain habits we hold. And so, well, anyway, thank you very much once again for joining us here today.
Yes, thank you.
Thank you very much. And guys, make sure to check out our various resources on our website as well, including digital publications, which you can access for free. You can access them from your smartphone or also your tablet or your laptop, of course. So make sure to check them out, and stay safe, guys. Take care of yourselves. For Mental Health California, my name is Matt Akai. See you soon.
Thank you.